like on the ship, especially when you found out what was going on?
For me, it was the shock. I was just in shock. I just didn't think about having a virus on the ship. I just didn't. I felt safe.
So just to update everybody,
Yes, we were.
just to make sure everybody knows, these are not the first two guests that have gone home. Several went home yesterday. There are probably others, depending on testing, that will go home this week. And maybe, Shelley, you'd want to comment on that?
It was very uneventful yesterday, and they had 3 consecutive negatives 24 hours apart, so we were able to get them out yesterday and headed home.
How many have left?
2 yesterday and 2 today. So 4 of the 15. So we have 11 remaining.
Correct.
Are you anticipating more coming in to the next center now? Or?
At this time, today, right now, no. Is that possible? Yes. But we know of no current missions or requests.
With the arrival of the virus in a bigger way in the United States, is there a scenario where you see yourself being utilized for people within the United States, or are you still going to be likely used for people who are being repatriated?
So let me just say, currently an extensive amount of training and education, information sharing, best practices widely across the country, but particularly in Washington, Oregon, California, and globally for that matter. In terms of clinical utilization, not currently. We'll see.
I think repatriation is less likely at this time, but I think more so, yes, if there are states or regions, we're still really very much about containment, although I think that's going to quickly change as more and more cases evolve. So
other than use of it for people within Nebraska, potentially, under what scenario would either the quarantine or the biocontainment unit be used compared to these cases?
So if our federal partners asked us to take folks to quarantine, we would definitely discuss that and entertain that. We are the Region 7 treatment center. There are 10 across the U.S., so we are the Region 7 Iowa, Kansas, Missouri, Nebraska treatment center. So if someone in our region wanted to utilize our services, that would also, early in the onset of this pandemic, be an option.
So 4 of the 15 left yesterday, and then these 2 that will make 6.
No. 2 yesterday, these 2 today, so there are 11 remaining.
Ladies, did you know each other before this whole thing?
An hour ago.
And Joanne, do you mind if I ask, is your husband here?
He's in the quarantine.
Okay.
He's
still in
quarantined.
the quarantine
Yes.
as well
Yes.
as your husband, Jerry. Okay.
He was positive and I was not.
We're the only 2 negative people in Nebraska from the ship.
You say 2 were released yesterday, 2 today. Do you anticipate 2 more tomorrow, or where do you stand with the other patients?
Well, the testing regimens are ongoing now, and so I wouldn't really be able to tell you exactly numbers and dates when they would go home. That all depends on negative testing. But there are potentials that would be able to go home this week, pending negative testing.
So you have others that have already tested negative twice, and hopefully today will be the 3rd time?
Well, as far as the numbers, there's a variety of different testing sequences going on, depending on when they ceased having symptoms, did not have a fever. They're not all on the same timeline. So it's difficult to say exactly when people will be going home, but there are several that would have potential for 3 negative tests and home this week.
What do you know about COVID-19 that you didn't know maybe 2 weeks ago by having some people to examine?
I think, being around the people who have the infection and observing symptoms, and I think that Jerry mentioned that fever and cough being the most prominent symptoms, that we've definitely seen that. Not as much nasal congestion, sore throat, myalgias, GI, gastrointestinal type symptoms that we see with other viruses. So I think that's one thing that we've definitely seen. I'd like to say that the folks who are in quarantine, that they're thanking us, but I'd like to thank Jerry, Joanne, and everyone else for being so cooperative and so gracious, in a situation where they are, very much their freedom's been taken away, been compromised. That they've been very cooperative and very easy to work with, and we really appreciate that. I've also learned that we mentioned the support that they need during quarantine, and I think we've had excellent support from folks with Nebraska Medicine Behavioral Health, and particularly David Cates running our town hall, giving them strategies for dealing with the situation and helping our staff. And so those are the main things I think I'd take away.
A lot of the questions we're getting is, a lot of people will say more people die from the flu. What is it about this specifically, COVID-19, that concerns you the most? Or what is it that you can relate to people that are watching that shows the difference between, is it the spread, is it the mortality rate?
Maybe I can just take a little bit of that and then let Mike and others comment. What we know about this is that it is not exactly like the flu. It is slightly more infectious, probably 1.5 to 2 times more infectious than the flu. The prodrome, or the incubation period, is longer. Flu tends to be a matter of 2 to 3, maybe 4 days. This can be 10 to 14 days. The duration of the illness appears to be somewhat longer. Flu hospitalizations, for instance, tend to be 2 to 3 to 4 days. We're dealing with hospitalizations here that can be as long as a week. ICU utilization, intensive care unit utilization, seems to be somewhat higher as well. And also the period of virus shedding that occurs after people are well and they're ready to either be discharged from hospital or go back to work. It appears that the period of virus shedding is somewhat longer as well. Those are at least that's what I think about when I compare and contrast this to the flu. The flu mortality rates are a small fraction of a percent. The numbers that are being quoted, at least from China and from other parts of the world right now, are roughly in the 2 to 2.5% range. Granted, that may be a very skewed number because we don't really know how many people are infected. If 10 times as many people are infected, it's not 2, it's 0.2. So only time will really tell. But other thoughts?
I think that is a great summary. I agree with those points.
Well, I mean, I think the one thing is that we're all nascent. There's no immunity to it, and there's no vaccine yet. So everyone could be at risk for it.
And I think that is exactly what I would emphasize is we've got a short period of time where likely the cases will exponentially increase. And with no vaccine, then you're talking about a lot of people. And of those, like we've mentioned, a very small percentage will have severe illness or even fatality. But when you look at no one has immunity to it, that's a lot of people. So we just need to be mindful of that and really do our best to implement certain things that would be helpful to mitigate that, which might mean social distancing and perhaps stopping large-scale events and things like that. And I know no one wants to hear about that, but those are the things that are going to be really important to really slow it down in communities where the prevalence starts to happen.
Captain Hall, with the events that have unfolded on the West Coast, is there a kind of different mindset the public health professionals are ratcheting up into? I know you've thought about and trained for this type of thing, but this past weekend seems to have taken it to a little bit different level for this country.
I mean, I think our public health measures are consistent across the nation. We were focusing on containment. Now we're focusing on mitigation. So those are the same public health practices. So regardless of where you are in this country, that's what we're working toward. And again, the social distancing and really emphasizing that. And so nothing's changed between here or the West Coast.
For a lay audience, explain what you mean by the difference between containment to mitigation.
Well, mitigation is like preventing the spread of the disease. I mean, containment is, containment is preventing the spread of the disease, and then mitigation is lessening the impacts from the disease. So we're moving now towards more of a mitigation phase, where we try to delay the onset and push it out through these behaviors that we're emphasizing: the social distancing, the hand washing, the teleworking, and distancing ourselves from each other. Do we know yet whether people could still test positive later on,
or develop this later on. There's been cases in Texas, apparently a case in San Antonio where someone was released from quarantine, later tested positive. And do we know, even if you're positive, if you still are positive and have the bug in your system, can you then spread it still, or do you know any of those?
Well, I think that's why our testing regimen is what we're following, is to try to lessen that risk. And so far, we worked with the CDC, with ASPR, to put together the testing regimen that we have in place. And I think that with the 3 negative tests, we feel confident that the folks can take leave after that.
Do you think there'll come a time when we have to stop meeting in large groups? And I ask that question because the NCAA is talking about playing basketball tournament without fans. I mean, have we reached that point, or will we reach that point?
Well, I mean, it depends on how many cases we're seeing in the community, and if we are seeing cases increase, then those are the types of measures that I think we all need to prepare for, whether it's NCAA basketball or schools, churches, other areas where people are getting together. And so that's, I think, the conversations that should be going on now within communities.
There are just multiple different predictive models, and until we have a little bit better clarity as to the rate and the direction that this is going to change, it's going to be very difficult for the NCAA or anybody else to make these decisions. But just coming back to Governor Ricketts' metaphor of the snowstorm, you don't want to start stocking up and putting the chains on the tires after there's 6 inches of snow on the ground. You really want to prepare as best as we possibly can before it starts to snow. You look at things like tornado warnings, hurricane warnings, flood warnings, things along those lines. We've gotten very sophisticated in this country that we're working very, very hard to be able to predict the timing and the severity of these types of events. But the whole reason we do that is to get ahead of them, not to have to play catch-up. And that's all the effort that we are engaged in, and that our federal and our state partners are so actively engaged in.
As soon as last week, the administration, some of the officials were using words like describing the response to this as a hoax and the like. Has that been counterproductive for the messaging that this group has had?
I'd rather stay away from the politics of this and be focused on the facts. The facts are that we don't know which of the models are going to be the largest and most prominent or prevalent in the United States. We've spent an awful lot of effort on the containment phase of this, which I think is appropriate in the early stages of it. And now we need to move towards the mitigation stage of this. And I think as a nation, we are moving, and all of us across this table, myself included, are tightly tied on the federal, the state, and on the county level. And I think that is the philosophy moving forward. And I ask our colleagues to comment, but
I think our public health folks also have great surveillance of what's happening in our community and our state. So we'll continue to rely on those, just like we do during influenza season. And I would also just say that none of what we're talking about from a pandemic preparedness perspective should be surprising. We should all be doing business continuity planning day to day in our businesses and in our healthcare facilities, and we should also have a pandemic plan. So this is a potential thing that we always work around. So now's the time to really update those assumptions in those plans and start making sure that the strategies we've identified are going to be successful, given the modeling.
I understand that physicians here are working on a drug to treat COVID-19, and a patient here was one of the first to receive that drug. Can you talk about that? And update with that also.
Well, that's correct, that there was a patient who was enrolled in a study to use an antiviral to treat COVID-19.